Do you have hypermobility, Ehlers-Danlos syndrome, or both? You wouldn't guess it, but so do I. As us zebras know, this comes with a lot of pain. I have a lot of back pain, hip pain, knee pain, neck pain, and shoulder pain. You know, just the whole thing. But anyways, I wanted to make this video because after 8 months of PT and having severe chronic pain, I found some physical therapy things that helped me. On online forums, I constantly see people complaining about hip and back pain in the SI area, that they've had x-rays, MRIs, everything's normal, and it just hurts all the time. I relate, I had that too. What my physical therapist taught me, that we have a weak pelvic floor is what that means. If I'm wrong, feel free to correct me in the comment. But my guy, when I was having extreme pain in this T by my lower back, all of this, it was because I was not engaging my belly the right way. What does this mean? As a society, we talk about our gut a lot. As women, we're taught to stick out our ass and kind of like have like a, kind of just stand like we don't care. It doesn't matter like what we're doing here. Standing is like a relaxing activity, right? Wrong! You can be sitting, standing, laying down incorrectly. I was, and that's why I had a lot of pain. So, what can we do about it? This is the easiest, simplest hack I can give you. If you have recently had a lumbar puncture or spinal tap, do not do this. If you have slip discs in your everything down in the back area and it's not coming back normal, don't do this. I am not a medical professional. I don't know what'll happen if you do this. This is for Ehlers-Danlos people who have had x-rays and imaging and it's come back normal, and yet you're still in all this chronic aching pain, okay? Okay, now that we got that out of the way, this is how I was standing around all the time. I had a curvature to my lower back that I wasn't supposed to have. I was sticking my butt up and out because that's what I've been taught as a woman we should do, have our butts look good. When you stand like this, you tilt your hips forward. And this is horrible for your posture. So instead of pushing out and doing this, you're gonna take your hips and pull it forward. So you're gonna go from this to this. I know it sounds like that's how you're supposed to do things. You're not. Trust me, I've been doing it for years. Had tailbone pain, lower back pain, which then spread to the rest of my back because my whole posture was messed up. It's a whole thing. Stay with me now. We've taken the hips, we've rolled them forward. You're gonna take your lower belly right underneath your belly button, and you're just, so this is where I was before. You're gonna pull it in, pull with these muscles right here, hold it and release. You should feel a pull all the way back here. It's taking your lumbar spine and forcing it. You can Google things about this. You can fact check me. I highly support that. We can pull forward our hips, pull in our lower belly. Once you have your hips forward, the way that I do it is I relax, pull my lower belly in, hold it. I feel a lot of strain down here because I haven't been able to do it for a while due to a lumbar puncture. You're not supposed to engage your lumbar spine. So pull it in, 2, let go. Pull it in, 2, let go. And when you let go, you shouldn't be returning back to wherever. You shouldn't hunch forward. You want to try to make sure too to keep your shoulders pulled back. So the other things my PT guy recommended was taking my shoulder. This is where I like to hang out because it's the least painful. It's incorrect. You'll want to basically roll your shoulders back and pinch them together. In the back, when I do this, I'm taking my shoulders and just pinching the shoulder blades together. I'm not overly doing it, exaggerating this movement. Ooh, that hurt. Ooh, I have a slipping rib that is right in that area. That was very aggravating. Don't do that! You're just gonna pull them together. Once you can do this, you can incorporate this. Once you don't have to think about pulling these muscles in so much, you can focus on having the good posture, and that'll default good posture. Are you going to be able to sustain this? If you're not physically fit, absolutely not. For me, with how much pain I was in, I used to be a gym girl. Personal recording every time I was in the gym, lifting heavy weights, doing balanced workouts, and like that used to be me. And then I was much less active, also depressed for like 3 years of on and off doing stuff. All of my body deteriorated. All of those supporting muscles deteriorated. My body started compensating for those atrophied, weak supporting muscles by carrying my body like this. And then I started having severe back pain, and it spread to up here too. I just simply doing this one exercise Well, I guess it's 2. You want to do this and you want to do the shoulder thing. So shoulders back, kind of up, just like that. And then pulling that lower belly in while tilting the hips forward. Don't overdo it and be like kind of leaning back. You just want to take it from here and be like that. One more time. If this is how you are carrying on and you think it's cool to stick your butt out like that, eventually you're going to have back pain. If you don't have it now, you will. And if you have Ehlers-Danlos syndrome, you probably already do. We're going to go from back here, sticking our butt out, tilt our hips forward, suck our lower belly in, shoulders back. This is proper posture. This is where regular people exist. How do they do it? I don't know. I'm not one of them. Follow me for more tips. I hope this helps somebody. If you have any questions, feel free to comment. This is just one exercise of many that I can put out there. Again, I learned this in physical therapy. I am not a medical professional. Ask your doctor for any help. Consult them and ask for physical therapy. If you suspect you have Ehlers-Danlos syndrome, traditional physical therapy is not going to be good for you. It will actually do more damage and maybe even cause arthritis. Be safe out there, make good choices, drink some water.